Cervical spine, joint position sense, evaluation, and retraining. Cervical joint position sense, or JPS as I'll call it from now on, has been shown to be reduced in individuals with neck pain, particularly in those with whiplash-associated disorders, and there are several references to support that. Cervical mechanoreceptor dysfunction, reduced JPS, have also been associated with dizziness in those with whiplash-associated disorders. The bad news is that reduced proprioception, or JPS, may be a contributing factor to persistent neck pain. But the good news is that studies have shown that proprioception, or JPS, retraining may help reduce pain and disability associated with neck pain. Compared to usual strengthening exercises, proprioceptive exercises that involve precise repositioning tasks may have a greater positive effect on cortical reorganization of the cervical spine. And what is a precise repositioning task? This is what this short presentation will review. Cervical JPS is very complex, as muscles, tendons, skin, intervertebral discs, ligaments, zygapophyseal joint capsules, vestibular and ocular systems, etc. all send information on proprioception to the central nervous system. The laser point assisted angle reproduction test, also referred to as LPART, has been shown to be a potentially clinically applicable and reliable test. The LPART requires the patient to memorize various joint positions with eyes open. Then, with the eyes closed, they're asked to reproduce the same joint positions as before. To evaluate cervical joint position sense, an adjustable laser pointer is attached to a patient's head with a head strap. Step number 1. The patient stands on the center red footprints of the STARmat, which is 100 centimeters from the STARmat Wall-target. Step number 2. The patient is asked to stand up tall and position their head where they feel is a comfortable neutral position. You need to correct the forward head posture in some people though, if they have exaggerated kyphosis or forward head posture. Step number 3. Then they're asked to close their eyes and remain still while the laser is turned on and adjusted so the beam is positioned in the center of the target as accurately as possible. This is done by the therapist. Step number 4. With the eyes still closed, they're requested to slowly turn the head to the right as far as comfortable, to 3 o'clock, and then slowly return back to the neutral head position as accurately as possible, the center of the target. Once they return, the new position of the laser beam is noted and the patient is asked to open their eyes. The distance between the new position of the laser beam and the center of the target is measured. Well, in fact, it's just estimated. The test is repeated another 2 times and the average of 3 trials is the outcome. Basically, the way we're going to be using the STARmat Wall-target is either they're good or they're not good. Step number 6. Step number 4 and 5 are repeated for neck rotation to the left, which is 9 o'clock, for extension, which is taking the laser up to 12 o'clock, and for flexion, taking the laser up to 6 o'clock, as you can see on the image on the right. So what is normal? If it's inside the center red target, 0 to 4 centimeter error, this is considered excellent, and some people are actually excellent, as you can see on the image on the right. If they're within the first gray zone, 4 to 8 centimeters error, it's considered good, as you can see on the image. If they're within the second red zone, 8 to 12 centimeters error, this is considered fair or normal, and most people are somewhere within this target. Anywhere outside the second red zone, greater than 12 centimeters error, is considered poor. And anywhere outside the target completely, which is greater than 16 centimeters error, can be considered very poor. And this is seen in people with severe whiplash-associated disorder, those who have been immobile for a long time, with poor deep neck flexor activation, and with extreme nausea and dizziness. Now there's advanced cervical JPS evaluation outside of the one we just did. For this one, step number 1 is to familiarize the patient with the clock pattern. Ask them to use the laser beam to slowly trace the 12 clock lines with their eyes open and as accurately along the line as possible. Step 2, ask the patient to now close their eyes and move their head towards a specific number on the clock and return to the center again. Example, ask them to slowly move your head to 1 o'clock and return back to the center. You're testing to see if they remembered what they did just a few seconds ago, moving their head with eyes open to 1 o'clock. The degree of error can be easily observed during this exercise and is noted. As you can see on the image on the right, if they go exactly on the line, which is unlikely with eyes closed, then that's considered a perfect pattern. However, if they're off by less than 5 degrees, it's still considered excellent, as you can see on the image on the right. If they're off by 5 to 10 degrees, that's still good. If they're off by 10 to 15 degrees, that's still fair. However, if they're consistently off more than 15 degrees, that's considered poor. As you can see on the image on the right, that means you're quite a bit off the target 1 o'clock. Now, how would you do the cervical JPS home program? Well, here's the great news. No laser beam or STARmat Wall-target is required to do the home program, joint position sense. The patient is to simply close their eyes and consciously move with full awareness, move their head, neck, and the clock pattern in the 12 directions several times a day. Basically, look in front, close your eyes, and then move your nose as if you got a pencil at the tip of your nose to 1 o'clock and slowly come back to center again. And go to 2 and slowly come back to center again. Go to 3 o'clock and come back to center again, and so on. Other exercises you could do, instead of a clock pattern, you could write the alphabet. You could spell your name. This can be done anywhere at any time, except while driving, of course. Now, the JPS exercises should ideally be prescribed to anyone with acute to persistent traumatic neck pain. Example, whiplash-associated disorders. The conscious movements may help minimize the loss of proprioception and joint position sense and potential somatosensory cortex reorganization. Head repositioning training with eyes open and eyes closed has been demonstrated to improve cervical JPS patients with chronic neck pain. There's evidence to support that cervical JPS or proprioception is reduced in some individuals with neck pain. And to further summarize, there's also evidence that cervical JPS or proprioception retraining can be effective in reducing pain and disability. In fact, one study showed that whether patients did deep cervical flexor exercises using the pressure biofeedback under the head or simply proprioception retraining for the neck, they had the same positive outcomes. To summarize, laser point assisted angle reproduction test, or LPART, may be an effective method of evaluating and training cervical proprioception or joint position sense, which also potentially improves tactile acuity and cortical representation. The STARmat package includes the anti-slip floor mat Wall-target, which has the clock pattern on it, measuring pole, which is used for lower extremity outcome measures, the motion guidance laser set, 2 of them with the head strap, and are all available on STARmatRehab.com. You can visit aptai.com for online course options. Thank you very much.